Hello and welcome to SimCast, the Higher Education Simulation Podcast. My name's Tony Jeremy. I'm the Academic Lead for Simulation-Based Education at UEA Norwich.
Hello everyone and welcome back to SimCast. My name's Lawrence Hill and I chair the Simulation Group in the School of Health Sciences at UEA Norwich.
This is part 2 of our 3-part mini-series on Simulation, a Learner's Guide. And in this episode, we're going to be talking about the simulation event or the simulation activity.
If you've enjoyed this video, please give us a like. Equally, if you haven't enjoyed it, give us a dislike, but please let us know in the comments why that is, because we're always keen to improve. Tony, episode 2.
Simulation activity. So this is the bit where I guess most people think this is what simulation is, but we've already alluded to there's actually 3 main parts. We've got the briefing at the beginning, the simulation activity, and then the debrief at the end. In the last video, we looked at the briefing, preparing you for the simulation activity. In this episode, we're looking at the activity itself.
Indeed we are, and we've got some intended learning outcomes that are here to cover this particular episode. So one of them we carried across from the first episode in this mini-series, which is to describe the 3 phases of simulation-based education delivery. That's a briefing, action, and the debrief, or the activity phase and the debrief. And the second 2 learning outcomes are to consider what you need to think about during the activity phase of a simulation, what kind of roles you can expect to play, etc. And also recall the expectations that we would have as educators of students or learners participating in simulation.
Okay, so the simulation activity itself. So depending on, I guess, where you are in your training, depending on where you are in your curriculum, simulation activity might mean different things, mightn't it?
Absolutely. And there are lots of different activities that can be described as simulation. Can you give some examples of what might be described as simulation activity?
Yep. So a lot of the time it's kind of physical, practical sessions. And that can be, for example, the first time you learn a skill. So when we learn a skill for the first time, to give learners the best opportunity to learn that skill, what we do is kind of isolate that skill. So let's say, for example, it's injection training. So what we might do is go through the actual sort of physical elements of how to do an injection, how to administer an injection. But in reality, when you do that on a real person, there's lots of other things that you have to think about: gaining consent, communicating effectively with your patient. There might be other things, for example, checking drugs and those kind of things. But when you're learning a skill for the first time, that can kind of overload you. So what we do is we focus on the skill in isolation. We do that skill in isolation. And once you've kind of developed some muscle memory around it, we can then add that to a host of other skills. So the next part of simulation is what we call simulated patient scenarios. And then what we're doing there is we are creating a scenario, often based on a real life event, and it introduces multiple skills simultaneously. So the ante goes up a little bit, I guess, in terms of the performance, but the idea is it is a realistic event that tries to bring the best out of the learners. Right.
So it starts off as kind of simple and gets more complex and more involved.
Yeah. And of course, those simulated patients, again, depending where you are on your training and your education, they can increase in complexity as well. So as an educator, for a year 1 scenario, I might be keeping it relatively simple. I might be asking you to introduce some kind of physical, practical skills alongside some what we would often refer to as non-technical or interpersonal skills. So communication, decision-making, prioritization, teamwork, those kind of things. And that's where simulation works really nicely because it combines the 2 together. You wouldn't just shove a needle into someone without communicating with them effectively.
No, right.
And so that simulated patient scenario helps to promote that kind of thing.
Yeah.
When I get to year 3, I might have a complex patient who has multiple problems with them or comorbidities and extra things that you have to think about. So the level of simulation should be applicable to the level of learning or where you are on your stage of the program.
Yeah, so you wouldn't want to have those really complicated, challenging kind of interpersonal relationships in a first year kind of simulation, unless I suppose that was appropriate for the course that you were on.
I think it would be unlikely.
Yeah.
I think it would be unlikely. But again, because we kind of hinted to this in the briefing section, it shouldn't come as a surprise. So I'm not going to throw in a curveball of a really complex patient where you haven't learned about a lot of the conditions and stuff until, I don't know, year 2 or year 3 in your program.
Yeah, fair enough. Okay. So if I'm a student coming into, some of the first simulations I'm going to be doing, like, am I expected to be actively involved then in the simulation?
So generally speaking, simulation is active participation. Okay. And again, it depends. So there's a number of variables. Often with those skills in isolation, you are going to practice that skill in on your own or in small groups. That's a way that's often done. But often you need to have to go at practicing that skill to sort of, again, build up that muscle memory. As we move on to those more complex patient scenarios, what we often ask for is volunteers. And again, what we might do in a session is we might have 3 or 4 different scenarios. But depending on your group size, there might physically be too many people to do those scenarios. So whilst some people might be actively involved, other people might still be participating, but just in an observing capacity. And again, it depends on where you're doing your learning. So that might be actually sat in the room watching, or if you're in a kind of a simulation center, they might have specifically designed rooms where you can watch what's going on remotely, often through a camera system.
Okay, so am I still an active participant in my learning then if I'm watching remotely from another room?
So I would say arguably yes, and there's a couple of reasons for that. So when you look at human performance, sometimes you can't see the wood through the trees when you're actively involved, when you're cognitively overloaded with what might be happening in the simulation activity. And when you're observing, you're almost like a fly on the wall. And so you can see things unfolding that the people in the simulation activity can't. So you can often provide a different perspective. When we come to debriefing in part 3, we can see the power of that in some of those conversations. There might be times where you have to be involved. Again, if we are doing a skill to get a competency signed off, or it's part of a set of practical documentation, for example, it might be a requirement from your professional or regulatory body that you have to achieve this skill, and therefore we might have to get you practically involved. So there isn't a right or wrong answer.
Yeah.
Sometimes you will, sometimes you won't, but there's always a potential for learning.
Yeah. Okay. And so you mentioned about getting skills signed off there. Does that mean that when I'm in simulation, I'm being assessed?
I think lots of learners think that simulation is all about assessment, that it's all about evaluation and judgment. What I would say is, whilst we can do practical assessments, so there's something called an OSCE, which is an objective structured clinical examination. That is an assessment which is done through practical demonstration. But that is an assessment. Simulation-based education, whether I'm doing a skill in isolation or whether I'm doing a simulated patient, that is an opportunity to learn. So it's not an assessment.
Okay.
We might have a constructive conversation. We might have sort of formative learning from it. And when we talk about formative, we're talking about kind of recurring and ongoing learning that will help you towards some kind of summative assessment. But for me, simulation-based education isn't about assessment. It's about learning.
So if most of the time then simulation is, all of the time it's about learning, but sometimes, particularly when we're focusing on isolated skills, there's a need to achieve a certain standard for safety reasons. And in those situations, I'll get some coaching and some guidance, but I have to ultimately be able to demonstrate that I can do this safely on my own, so that I can go out and do it on patients in practice.
Absolutely. So if there is a sign-off element, you have to reach a certain threshold to be deemed as safe or potentially competent in that skill. It depends what you mean by competent, I guess.
Yeah. Okay.
You certainly won't be developing mastery in that skill until, much later on in your career.
Fair enough. Okay. So if we're doing a more of a scenario rather than skills in isolation, how long would it last?
Well, that's a really good question. So, and again, that's it's got all sorts of potential implications. So where possible, we actually like to try and play things out in real time. because you can learn a lot about what happens in real time. So again, if we use, for example, a cardiac arrest scenario, there's some really important elements that have to be done within a certain time frame because it's time critical. However, we don't always have a finite amount of time. So there might be times where we will accelerate a simulation. If the normal course of practice is that things might take 2, 3, 4 hours, in reality, we might have to accelerate that time because we just can't play out in real time to get through the scenarios, the number of students we might have, so on and so forth. Where it is time critical, I think it is important to try and play it out in real time, though. So it's a trade-off sometimes because the world is the reality is, we don't have an infinite amount of time or a timetable that lasts forever.
No, okay, that's fair enough. And when I'm participating in a simulation, when I'm playing a role, how do I do that? Like, what do I have to pretend to be somebody else? What does it mean to play a role in a simulation?
That's a really good question. So I guess it depends on the role that you're playing. So if we're using one of these simulated patient scenarios, quite often we're asking the learners to step in and play the role of either a healthcare student or a student at a level or a professional at a level that we'd be comfortable with. If we've done our job correctly as educators, we shouldn't be throwing you in at the deep end and expecting you to just flourish. Okay. So it is about it's about getting you to perform at a level or an expectation, a level we would expect you to perform in. If we ask you to perform above that, then as a facilitator, we should help and guide you where possible. There may be other people involved in the scenario. So, for example, we might have someone playing the role of a doctor. I wouldn't expect a healthcare professional who is a nurse or a paramedic to try and play that role of the doctor because the skill sets might not be the same. They might not match or marry up. But in the scenario, we might need a doctor, and therefore we might have either we could get a doctor in, we could get an actor, we could get a faculty member to play that role as well. And again, it's to try and make that scenario both believable, but what those individuals might also be doing is steering the scenario in a certain way. So they might trigger certain events that happen that our learners then have to respond to.
Sure. And presumably then that is all made clear what their role is and who they're going to be in the briefing.
Done in the briefing. So we introduce the scenario. The scenario is X, Y, and Z. Probably a little bit about the patient background. So a bit of background about the patient, maybe some kind of assessment about the patient. And then there is such and such health professional in the role in this scenario so that those roles are nice and clear. Okay.
And you mentioned about time and about how sometimes this scenario might need to be, we might need to sort of fast forward in time. If I'm doing a simulation and my facilitator like pauses it or stops it, does that mean that I've done something really terrible and
no, not
I should
necessarily.
be ashamed?
No, not necessarily. The old-fashioned way of doing simulation is it was kind of taboo to ever stop a simulation. You just let it play out, and then when we come to the debrief afterwards, you have a discussion about it. Modern ways of doing simulation look at it slightly differently. And again, it just does depend on your level of learning. So a year one student, if they're in an environment and it's clear to the facilitator that things might be kind of not going to plan or the learner is kind of fumbling a bit, the facilitator might make a judgment call to pause it, maybe a micro teach, and then to maybe start it again. So that's one technique. There are new techniques like gamification where we can kind of pause it like you would a video game, discuss it, and then jump back into the game again and start in, or even do sort of tag team simulations. So there's lots of different scenarios, but I guess the key take home message is just because we pause it or we stop it, it doesn't necessarily reflect badly on the learner.
Okay, all right, that's good. I don't think I've got any more questions about the action phase at the moment. So I think that's kind of cleared things up. So we should probably think about wrapping this one up and returning to the intended learning outcomes.
Okay, so let's revisit those learning outcomes then. So the first learning outcome was to describe the three phases of simulation-based education delivery, which is the briefing, the action phase, which we've talked about today, and the debrief, which is we're going to lead on to in the next episode. To consider what you need to think about in preparing yourself for that simulation activity. And to recall the key elements of the actual action phase itself, understanding what the action phase is.
So the time thing and the role thing and playing out in real time and suspending my disbelief and getting stuck in as best I can.
That's the aim. Yeah. That's what we want as educators.
Great. Well, thanks very much, Tony. And thank you very much for listening into this special edition of SimCast. We'll hope to see you on the next one. Bye for now.
Thanks, everyone. Bye-bye.